hard, but a very few study smart across a full year. And that's what makes all the difference. Hi everyone, I'm Dr. Himani. I did my MBBS from Maulana Azad Medical College. So I have cleared NEET PG, INI-CET and UPSC CMS, and I have been through all these 3 exam cycles myself. And hence I know how confusing it can be, where and how to start depending on how distant the exam is. So in this video, I'll be covering the year-wise preparation strategy, where we'll try to discuss how you should be preparing depending on which stage of your preparation you are in. So whether you're in your first year or your final year, whether you're an intern or post-intern, this video is going to be useful for everyone. So before we make a preparation strategy for any exam, it's very important that you first understand what that exam demands. So let's understand the 3 exams first of all. So talking about the difficulty, all these 3 exams are difficult in their own ways. Secondly, let's discuss the timing. So NEET PG is of 3.5 hours, INI-CET is of 3 hours, and UPSC CMS is divided into 2 parts in case of written exam. Each one is of 2 hours each, and after you clear the written exam, you're called for the personality test. Now NEET PG and INI-CET are computer based, while your UPSC CMS is OMR based exam. Talking about syllabus, so NEET PG and INI-CET covers your entire MBBS curriculum, while UPSC CMS is mainly based on your final year subjects: medicine, surgery, obs, gynae, pediatrics and PSM. Now since NEET PG and INI-CET are computer based, they have a lot of image based questions, and in fact sometimes they also put these small videos, while UPSC CMS does not have any image based questions. Now let's understand what each exam demands of you. So in NEET PG, you need volume of knowledge, and in INI-CET, you need depth of knowledge. Now what does that mean? So NEET PG will ask you vast variety of questions. NEET PG के जो difficult questions होंगे, mostly it would be like, ये तो कभी देखा ही नहीं है, नहीं पता है. So that would be the difficult question of NEET PG. Of course, NEET PG also has its fair share of tricky questions, and INI-CET I think makes the best tricky questions. So a question जिसका आंसर नहीं पता है, वो बस difficult है, वो नहीं आता था. But tricky question is one जिसको देख के लगे तो बहुत ही easy question पूछ लिया, ये तो आता ही है, ये तो बहुत easy है. And you mark the answer, you come back, you see the recall, and you see कि बस एक word उस question में ऐसा डाल दिया था जिसकी वजह से उसका आंसर ही चेंज हो गया. कभी कभी INI-CET का क्वेश्चन देख के लगेगा ये तो बहुत easy question है, इतना सीधा तो पूछ ही नहीं सकते, it must be something else. But ultimately it was the easy one. So that's how INI-CET tricks you. So that's why INI-CET is actually not just testing your knowledge, but also your reasoning and common sense and how attentive you are while giving the exam. Now, of course, NEET also asks sometimes tricky questions. The number of tricky questions has increased over the years, but still it's no match to INI-CET. Also, the number of questions from first year has decreased over the years in case of NEET PG, while INI-CET still asks a large number of questions from first year subjects. So if you are in your first year, you need to study your subjects well, specifically for INI-CET, because INI-CET will not even ask you superficial questions. वो first year में भी depth में जाएगा. And UPSC CMS would ask you many repeated questions. So UPSC CMS is one exam जिसमें previous year questions सबसे ज़्यादा repeat होते हैं. अब CMS में क्या होता है? Either they will give you very direct question, सीधा one word answer, जो कि या तो आता है या तो नहीं आता है, and you will know then and there कि इस question को skip करना है या करना है. It will not trap you like that. Then there are some tricky questions in UPSC CMS as well. Now what do? They give you 4 or 5 statements, and then they ask you which ones are correct from this. Now it can be 2 statements which are correct, it can be 3, it can be 4. That way it gets very confusing, and कभी-कभी options भी बहुत ज़्यादा similar होते हैं. In short, NEET PG, you need volume of knowledge. INI-CET, you need good reasoning, you need to be attentive during the exam, you need to have common sense, and you need to have knowledge in depth. And UPSC CMS जो statements देता है, they are mostly from your textbook as such. So if you have read textbooks sometime in your life, it would be very useful in this exam. So basically, the syllabus is overlapping in all these 3 exams, but you need customization for each of them. So now that you have understood what each exam demands of you, Now let's understand how your approach should evolve with each year. So first of all, starting with the first year students. तो पहली बात तो I don't think first year should be about exam preparation as such. You have just entered MBBS, enjoy karo, acclimatize karo, adjust karo. But a few things that you can do in the first year itself. First of all, INI-CET would ask questions from first year, that too in depth. So try grasping those concepts. Because after that, you might not have that much time to read those subjects in depth. So यहाँ पे पढ़ना सीखना है. In first year, you have to understand how to read and what to read. क्या चीज़ याद रखनी है, क्या चीज़ छोड़ सकते हैं. That is what you have to do here. अब जो MBBS की बुक्स है, उसमें बहुत सारा कंटेंट है, सब कुछ नहीं पढ़ना होगा. So in first year, try learning कि कैसे figure out करना है कि which part is important for you and which part is not. Which part needs to be just read once, which part needs to be revised over and over again. So once you understand that, it would be extremely helpful for you in your entire MBBS and even after that. So one way to figure that out is कि जो previous year में पूछे हुए questions, बस वो सब repeatedly textbook से वो topics पढ़ते हैं. Not just the answers to those questions, but the whole topic. So this is the right time to start studying from books. And if you are thinking कि मैं first year के subjects खत्म करके I can also start with second year, third year, at least I will do first and second year in first year itself, I would not suggest that. It would get very overwhelming for you. You have just entered MBBS. You need to adjust yourself to the environment first. There are a lot of things that would be new for you, including the vast MBBS syllabus. So I would suggest do not overdo. Stick to your first year subjects. If you try to be an overachiever, it might get overwhelming and you will burn out right in the starting of the journey. And we don't want that. We want consistency. The graph should keep going up. Now it doesn't matter slope kitna steep hai, but it should be going up and not down. One more thing, anatomy might seem to be very overwhelming for some people. For me personally, anatomy was very overwhelming. मैं बहुत ट्राई करती थी, हो जाए याद, नहीं होती थी. So please don't get disheartened. Even if you can't remember anything, I mean for me it was anatomy, for you it can be physiology or biochemistry or any other subject. But it doesn't matter. You just have to keep trying. नहीं हो रहा है, it's okay. You have 18 other subjects. And one mistake that I did was I just kept studying anatomy because वो मुझे समझ में आती नहीं थी. So at the end, मैंने फिजियोलॉजी और बायोकेमिस्ट्री को कम टाइम दे दिया. सो बायोकेमिस्ट्री स्टिल आई वाज एबल टू डू, बट फिजियोलॉजी मेरी बहुत खराब हो गई थी. डोंट डू दैट मिस्टेक. इफ यू आर नॉट एबल टू अंडरस्टैंड वन सब्जेक्ट, डोंट जस्ट गिव अप ऑन अदर टू. इट्स नॉट वन सब्जेक्ट यू हैव टू स्टडी, इट्स 3 सब्जेक्ट्स एंड तीनों को अटेंशन चाहिए, तीनों पढ़ने हैं. सो फर्स्ट ईयर स्टूडेंट्स को क्या करना है? You have to study books. You have to understand what to study from books and how many times to revise each part of that book. You have to learn to build concepts. You have to learn to build strategies, and most importantly, you need to adjust to the environment and the curriculum and the syllabus. And do not stress too much. Don't try to do everything at one time. It will get overwhelming and ultimately you will burn out, and we don't want that. Moving on to the second year. So I personally started preparation during my 4th semester. But at my time, second year used to be of 1.5 years. मतलब 3 semesters होते थे, 3rd, 4th and 5th. So that's why I started preparing in 4th semester. So second year is the time when you can start preparing specifically for these exams. But यहाँ पे from this point onwards, you have a lot of time. I would suggest study in detail. Don't go for shortcuts at this point of time. Like PTR, rapid revisions. These are not for you at this point of time. You need to study detailed videos. Like, for example, you can take any coaching platform like I did with Marrow. Because Marrow is the most detailed one. And क्योंकि मेरे पास बहुत ज़्यादा time था going forward, so I decided on Marrow. You can choose any coaching institute of your choice. And even if you don't want to, you can just do studying from your books and make your own notes. But at this point of time, you have to build concepts. Now, second year subjects are paraclinical. So you will start feeling like now we are studying about diseases. Now we are studying about medicines. So it would feel a bit interesting also as compared to the first year. Talking about subjects, just first year, my anatomy was very difficult for me. Most people find pharmacology difficult in second year, but for me it was my personal favorite. मुझे बहुत अच्छा लगता था दवाइयों के नाम याद करना. And I agree, pharmacology is very difficult to remember. But once you keep revising it, और एक बार वो दवाइयों के नाम याद होने लग जाएंगे ना, this might become your favorite subject also. Pharma में what you can do is सब कुछ याद करने की जगह just keep on revising. If there is, for example, a class of drug, सारी दवाइयों के नाम याद नहीं करने हैं. Remember 2 or 3 examples which are most relevant. अभी के लिए this much would be fine. धीरे धीरे करके जब बाकी subjects में we'll read about the medicines, you will keep on grasping more and more. You will start understanding more and you will start remembering the names more. अभी के लिए just stick to जितना याद हो रहा है. Just stick to 2 or 3 examples for each class of drug. Understand the concepts. Pharmacology में बहुत सारे concepts होते हैं, like mode of action क्या है. अब इस point of time पे if you understand how the normal body works and where that particular drug is acting, you would of course understand the whole concept. So pharmacology, even though ऐसा लगता है it's all about cramming, it's not. It's actually very conceptual. The only part that needs cramming is the name of drugs. And just as I told you, you do not need to remember all the names. Just 2 or 3 examples are more than enough. And one more thing, you can make a list of drugs. So what I did was, I made 2 lists of drugs. एक तो हर क्लास ऑफ ड्रग उसके सारे एग्जाम्पल्स का नाम. एक लिस्ट तो वो थी. दूसरी लिस्ट थी हर कंडीशन के लिए ड्रग ऑफ चॉइस. सो उसकी लिस्ट बनाई थी. So these 2 lists you can keep revising again and again, and I think 40% of the pharmacology will be covered there only. And even though I said कि second year is a good time to start preparing for these exams, please do not rush. It does not mean कि अब सब कुछ पढ़ना है. नहीं. Be slow and thorough. And you keep revising from your notes. And second year subjects जो है जैसे pharmacology है, microbiology है, specifically these 2, they need a lot of remembering. So ये बहुत volatile subjects होते हैं. In that case, you can make your notes and you keep revising from the notes only. Pathology also you will make notes, but I think pathology की books में ना there are lot of concepts. जैसे Robbins एक story की तरह हर concept समझाता है. So you can read Robbins again and again. But for pharmacology and microbiology specifically, I would recommend make notes and keep studying from them. Pathology also, if you want, you can study from notes. बार बार revise obviously करना है because you need that photographic memory. I keep saying that and I say that again. Does not matter which stage of preparation you are in, you should have photographic memory. And that's why you need to keep revising from whatever source you are using. And best way to keep revising is making your own notes. And your target should be that by the end of second year, whatever I have studied, whatever I have made notes of, should be residing permanently in my brain from now on. अब जो professional exams होते हैं, your profs, they also have similar content. जो notes बनाए हैं, of course, they are very useful for that. But notes हमने NEET, INI and CMS इन exams के basis पे बनाए हैं. Profs के लिए क्या होता है? See all the previous year questions. Multiple times revise those topics from your textbooks. अब यहाँ से textbooks भी cover हो गई profs के लिए. And those textbook readings would help you in the future. Prepared for your profs as well. And CMS में तो textbook से question फिर आता ही है. In that way, you will be studying notes also and textbook also. So in second year, you can try कि third year का थोड़ा सा part पहले cover कर ले. But you have to be thorough here also. Don't rush right now. Now, for the students who are in third year, please do not ignore PSM. I know it feels very boring and tiring, but you have to understand it is a very important subject. And third year में PSM के अलावा जो subjects होते हैं, they are not very vast, so you can start preparing for final year as well. And by the end of third year, try completing at least 2 major subjects of final year also, क्योंकि final year में बहुत ज़्यादा subjects हैं, and those are also very major subjects. So at least we'll try to complete 2 major subjects in the third year itself. And also whenever you go to clinical posting, start seeing patients. Don't just sit there and do your own thing. Start seeing patients because एक बार एक disease का patient देख लिया ना, तो उसके बाद उसकी चीज़ें बहुत अच्छे से याद होती हैं. And there is very less chance of forgetting those things. And the same goes for every other student who is seeing a patient. I mean, first and second year में you don't really know the clinical subjects that much. But since third year में we are trying to start with final year subjects also. So this is correct time when you should start learning from patients. So every day in your clinical postings, make it a target that you will see one patient and you will read everything about that condition after you come back, or even better if you can read it then and there. Now coming to final year students, at this point of time, you need to increase your speed. क्योंकि इस point of time पे हमें final year का भी cover करना है और जो पहले जो first, second, third years थे उन सब का भी रिवाइज करते रहना है, बिकॉज वी कैन नॉट रिलाई ऑन द इंटर्नशिप ईयर. उसमें टाइम मिले नहीं मिले कितना मिले वी डोंट नो दैट. सो कंसिडर फाइनल ईयर एज योर लास्ट स्टेप ऑफ प्रिपरेशन एंड इंटर्नशिप को सिर्फ रिविजन के लिए रखो. सो फाइनल ईयर में इतना सारा सिलेबस भी कवर करना है. यू ऑल्सो हैव टू सी द पेशेंट्स, बिकॉज अल्टीमेटली फर्स्ट ऑफ ऑल पेशेंट्स देखोगे तो चीज़ें याद रहेंगी. दूसरी चीज़, MBBS में आए तो डॉक्टर बनने के लिए हो ना. अगर पेशेंट्स ही नहीं देखोगे तो क्या मतलब है फिर. एंड एवरी सिंगल पेशेंट टीचेज यू एटलीस्ट वन कंडीशन. इन शॉर्ट, you do not have to rely on internship for your exam preparation. Final year, consider it as your last step in preparation. After that, internship will keep for revisions only. And here you have to complete your whole syllabus. You have to revise this year and the previous years as well. अब अगर यहाँ पे इस point of time पे इतना ज़्यादा pressure लेके चलोगे कि अच्छा ये भी करना है वो भी करना है ये सब करना है, you will again get exhausted. And फिर ये सब वो सब छोड़ो, सब कुछ छोड़ के बैठ जाओ. So वो भी नहीं करना है. You need to make your studies interesting. Now how would we do that? Just as I told you, रोज क्लिनिकल पोस्टिंग्स में एक टॉपिक बुक से पढ़ने की कोशिश करनी है. वापस आकर यू हैव टू मेक नोट्स फॉर योर एग्जाम पॉइंट ऑफ व्यू. उसके लेक्चर्स अगर देख रहे हो तो लेक्चर्स देखने हैं. सो वापस आकर सब एग्जाम पॉइंट ऑफ व्यू से पढ़ना है और वहाँ पे सब पेशेंट को ट्रीट करने के पॉइंट ऑफ व्यू से पढ़ना है. सो एट द सेम टाइम यू आर बिकमिंग गुड डॉक्टर and you are able to learn for your exams as well. और profs के लिए वही करना है. You have to study previous year questions from your textbooks ताकि उस बहाने से textbook भी पढ़ी जाए. And in final year, when you have completed your syllabus at least once, उसके बाद you can start watching videos of rapid revision and BTR also. But अभी भी these are not the base of your preparation, because final year, just as I told you, we are not keeping for revision, rather we are keeping it as a लास्ट स्टेप ऑफ योर प्रिपरेशन. रिविजन के लिए इंटर्नशिप को रखा है. सो रैपिड रिविजन एंड BTR जो हम रिवाइज करते रहेंगे ना, वी विल डू मेनली इन इंटर्नशिप, क्योंकि वहाँ पे ऑफ कोर्स इतना टाइम भी नहीं है कि डिटेल में सब कुछ पढ़ते रहो. एंड वन मोर थिंग दैट यू कैन डू इन फाइनल ईयर विच विल मेक योर स्टडिंग इवन मोर इंटरेस्टिंग इज, फाइनल ईयर में यूर स्टडिंग अबाउट सम कंडीशंस ना. लेट्स से एक कंडीशन आई, अब उससे रिलेटेड दवाइयाँ कहाँ से पढ़ोगे? फार्मा से. उसको जो भी बैक्टीरिया या वायरस जो भी इन्फेक्ट कर रहा है वो कहाँ से पढ़ोगे? माइक्रो से. वो कंडीशन हो क्यों रही है? पैथोलॉजी. सो यू हैव टू स्टार्ट इंटीग्रेटिंग एट दिस पॉइंट ऑफ टाइम. इफ यू आर स्टडिंग सर्जरी, यू आर सीइंग अ सर्जरी कि वो कैसे हो रही है, यू विल नीड टू नो द एनाटॉमी. You will be able to integrate all your subjects very beautifully if you do it right. So the motto is keep revising and integrating. So there were a few questions asked on my previous video. That person asked in respect to UPSC CMS, and that's how I would be answering it here. One of the questions was when you should start preparing from rapid revision or BTR. So that I have already answered just now. You should start it in the final year, but it is not the base of your preparation yet. It will become the base of your preparation in your internship. The second question was, if 5 major subjects have been completed till now should we go for minor subjects or should we start revising these 5 subjects? So I would not recommend specifically for CMS कि वो minor subjects पे अभी जाओ. I would recommend कि if you want to do those minor subjects, BTR से कर लो या rapid revision से कर लो. But CMS is mainly asking you major subjects. So focus on those major subjects more if you have not yet done minor subjects. क्योंकि even though minor subjects से भी questions आते हैं, but they are very less in number. And the next concern was that by final year, you have completely forgotten pharmacology. So I would suggest don't worry, keep integrating and you will understand what all drugs are important in pharmacology. And just as I told you, every clinical posting, one condition or one disease per day. In that you will also cover pharmacology. So बहुत सारे important parts of pharmacology will be covered there. Just keep integrating. Now talking about interns and post-interns. So I know interns have a very hectic schedule. So what you can do is, first of all, your target is solving as many MCQs as you can. And secondly, to keep revising from rapid revision or PTR. उसको इतना अच्छे से revise करना है that it gets imprinted in your mind. So that is the strategy for both interns and post-interns. अब interns के case में time नहीं है. So when do we do this? So एक तो होता है when you have light postings. So जब light postings है, you can pick up your major subjects and try covering them. जब hectic postings है, keep your subjects light. थोड़े कम subjects रखो या थोड़े light subjects जो वैसे भी याद हो जाते हैं, जिसमें तुम्हें पर्सनली कोई प्रॉब्लम नहीं आती है. सो कीप दोज सब्जेक्ट्स. सेकेंडली, वेन एवर यू गो फॉर रिपोर्ट कलेक्शंस या पेशेंट प्रेप हो रहा है एंड यू जस्ट वेटिंग फॉर दैट, इन एनी ऑफ दीज कंडीशंस, जब तुम बैठे हुए हो, यू कैन जस्ट ओपन योर मोबाइल फोन एंड स्टार्ट सॉल्विंग MCQs. इसके अलावा वेन एवर यू आर इन अ नाइट ड्यूटी एंड पेशेंट लोड इज नॉट दैट मच, अगेन यू आर सिटिंग, या फिर अगर दिन में भी ड्यूटी है और पेशेंट लोड उतना नहीं है, यू आर जस्ट सिटिंग देयर and you have let's say 5 or 10 minutes भी अगर है, so if we consider कि एक क्वेश्चन को करने में 2 मिनट भी लगते हैं, so 10 minutes में you can do 5 questions, that means 5 concepts. So do not underestimate those 10 minutes. Also when you have light postings, try giving tests. mock test देना शुरू करो when you have light postings. And if you are a post intern, तब तो mock test continuously चलते रहने चाहिए. टेस्ट को एक पूरा दिन लगेगा. You will first 3-3.5 घंटे बैठ के यू विल फर्स्ट गिव दैट टेस्ट. आफ्टर दैट पता नहीं कितने घंटे लग के यू विल एनालाइज दैट टेस्ट. एंड इफ यू डोंट नो हाउ टू एनालाइज इट, just go and watch my previous video. I have explained in detail how to analyze tests. But the point is कि एक टेस्ट देना मतलब एक पूरा दिन जाता है. And it does not matter whether you have a hectic posting or a light posting. MCQs तो चलते रहने चाहिए. लाइट पोस्टिंग है तो ऑब्वियसली यू विल गिव टेस्ट एंड MCQs वैसे भी करोगे. But if you have a hectic posting, तब भी just as I told you, when you are sitting idle even for 10 minutes, you have to do MCQs. And a very important thing, the purpose of MCQs is not to get them right. Get them wrong at this point of time. It's no issue unless you do not repeat the mistake. एक बार MCQ गलत हुआ, उसके बाद में वो कॉन्सेप्ट अच्छे से समझ में आ जाना चाहिए और अब उससे रिलेटेड कोई भी क्वेश्चन गलत नहीं होना चाहिए. So basically you are doing MCQs again to learn, not just to solve them, but to learn from them. Because you have to learn via questions. You cannot revise everything at this point of time. बाकी जब भी रिवाइज करने का टाइम मिले, you can always go to your rapid revisions and PTRs. अगर कोई specific topic में लगता है कि concept बहुत खराब है, for that particular concept you can also go back to your main notes. कुछ नया नहीं पढ़ना इस point of time पे. Revision is the key here. You have to keep revising. Don't go studying new topics every day. Just keep revising from now on. जितना add-on knowledge होनी थी हो गई. अभी एग्जाम के लिए पढ़ना है तो अभी जितना पढ़ रखा है उसको याद रखना है. Because at the end of the day, it does not matter आपने कितना पढ़ा है. एग्जाम में तो वही चीज़ इम्पैक्ट डालेगी ना कि जितना पढ़ा है उसमें से कितना याद है. सो अभी तक जो पढ़ा था उसकी वॉल्यूम हम बढ़ा रहे थे. नाउ वी विल इंक्रीज द वॉल्यूम ऑफ आवर मेमोरी, कि जो भी पढ़ा है सब याद रहना चाहिए. Now PYQs are especially important for CMS. बहुत सारे PYQs repeat होते हैं, but those are not the only thing that is important. You also have to build your concepts. Concepts are also very important here. And that's it. Just be consistent, stay calm. Trust me, everything will work out ultimately and you will fall multiple times. But it does not matter until you keep rising again. And if you have any doubt, just put it in the comments. I always try to read and reply to all of them. And that's it. Just be consistent, stay calm, and it will all work out one day.